Honorable Chair, PPD, Your Excellencies, colleagues, friends, and the media, we must thank UNFP and PPD for organizing this dialogue. We all know the pandemic has laid bare deep inequalities in almost all aspects of our lives and livelihoods, with the poorest in the developing countries the worst affected, including my country, Ghana. Moreover, the just ended COP26 deliberations in Glasgow has brought home the chilling and devastating impact of climate change on lives and livelihoods. Once again, the poorest in the developing countries being worse off. In the fast world of automation and digitalization, which is fast-tracked by COVID-19 pandemic and climate change, access to jobs now more than ever requires an educated individual, and once again, the poorest people in the developing countries are left further behind. In countries where most of the population is relatively uneducated and unemployment is also high, it can only get worse with automation and digitalization. Since automation thrives on a skilled workforce to increase workers' efficiency and at the same time decrease the need for workers, leaving no place for unskilled workers. With these emerging issues, now is time to prioritize reproductive health information and services if these changes are to benefit all. Otherwise, sustainable development will get more challenging and difficult to attain, making the lives of current and future generations, unfortunately, at times worse off in some parts of the world, especially Africa. Honorable Chair, just as some people have postulated that it was machines, not morals, that ended slavery in the industrial nations, can we hope that COVID-19, climate change, and automation will help finish the ICPD unfinished business of 1994 in the nearest future? Madam Chair, the worst hit populations during this COVID-19 pandemic, those bearing the brunt of climate change and those left behind by automation have something in common. They are the poorest of the poor, mainly in developing countries, and unfortunately, majority of them lack access to reproductive health information and services due to many ideological and cultural reasons, thus creating a barrier to building resilient individuals and bridging inequality gaps in all its forms and shapes. The question I really want us to answer is it possible to ensure healthy lives and promote well-being for all at all ages without a focus on reproductive health information and services as an integral part in the development ecosystem? The other question is, can we bridge inequality gaps without a focus on reproductive health information and services as integral to development? Can we really achieve sustainable development from generation to generation without prioritizing reproductive health information and services? What is the data saying? Don't we have enough data to remove the blinkers that prevents us from seeing the obvious? To what extent will African governments, policymakers, and officers adopt current policies in the unfinished business of ICPD to build resilient individuals, communities, and nations? Let all PPD countries, 27 of us, with one accord, affirm that meeting sustainable development goal is difficult, if not impossible, without repositioning reproductive health information and services. How do we ensure zero unmet need for family planning, zero preventable maternal mortality and morbidities, and zero sexual and gender-based violence? If we all affirm this, then how would duty bearers promote funding and resources for programs such as production of contraceptive methods and creating the enabling environment to execute the agenda? As PPD countries, our researchers and stakeholders really need to quantify the economic, social, and environmental benefits of reproductive health information and services. Madam Chair, with our quest to produce vaccines amidst COVID, our zeal for automation, and finally, the devastating impact of climate change, especially on the vulnerable who are being left behind in huge numbers, it would be a very big disservice to continue to ignore the obvious role of reproductive health information and services in sustainable development. However, in case duty bearers want to continue to refer to the unfinished business of ICPD 1994 and either maintain the status quo or progress at a slow pace, as minimum, they owe the citizens as duty bearers to make known the cost of social, economic, and environmental inactions and their reasons for supporting those positions amidst a compelling body of knowledge begging for attention and use for the well-being of all. Finally, Madam Chair, we have to explain why ideology and negative cultural practices continue to drive population dynamics instead of the time-tested, evidence-based policy direction and programs, which include production of contraceptives, training of requisite staff in quality and quantity, and creating the enabling environment to offer the badly needed services to women of reproductive age. In our opinion, PPD member states should seriously advocate for this alongside COVID-19 vaccine production to enable citizens not only to survive, but to thrive. Finally, we also need to find ways to counter the threat of misinformation and disinformation. We know, just as we are seriously discussing and finding ways to counter the threat of misinformation and disinformation during this COVID-19 pandemic, we should strategize to address the misinformation and disinformation about the role of effective population management in our individual and collective well-being, in meeting our sustainable development goal, and in creating the Africa we want, the world we want. We should come together and build a consensus-oriented group with members of different persuasions, especially the political persuasions, around the facts and be guided by evidence-based scientific information. Ghana, as a member of PPD, has repositioned reproductive health information and services central to national development. I thank you, Madam Chair, for the opportunity. Thank you very much.